The Supreme Court has unanimously ordered the return of 60 billion pesos in PhilHealth funds previously transferred to the National Treasury. Executive Secretary Ralph Recto, who was Finance Secretary at the time and directed PhilHealth to remit the funds, said he respects the ruling. PhilHealth also welcomed the decision. House Committee on Appropriations Vice Chairperson Zia Alonto Adyong said that regardless of the ruling, the lower chamber has already restored the amount through the 2026 national budget during the passage of the General Appropriations Bill. Meanwhile, Vice President Sara Duterte said the decision of the country's highest court must be followed as it is the final arbiter of the law.
Now, joining us to further discuss this matter is PhilHealth spokesperson Israel Ish Pargas. Good morning, Spokes. Thank you for joining us.
Hi, Doc Ish.
Hi, good morning. Good morning, Angelo and Angela.
Doc,
and magandang umaga rin sa lahat ng ating tagapanood.
Alright, Doc, thank you very much for joining us. Ano po reaction natin sa ruling ng SC?
Well, tinatanggap natin ang desisyon ng Korte Suprema, gaya rin ng ating mga dating pahayag, na whatever decision of the court, we will of course accept it. And it's a welcome decision po lang.
So ano po yung mangyayari dito? Kasi according to Congressman Adyong, regardless sa decision na restore naman daw yung sa 2026, pero meron din yung order ng Supreme Court na kailangan ibalik. So paano po yung setup nito?
Well, sa ngayon po, hindi pa natin napapag-usapan kasi bagong-bago pa lang yung desisyon. But, although ang utos ng Korte Suprema is immediately executory, meron din po dong nakalagay na kailangang pag-aralan pa rin ng Solicitor General and to see whatever will be the next step. Pero tama rin po kayo na doon po sa ipinapasa na GAA for 2026 na 113 billion as a subsidy for PhilHealth, yun pong 60 billion doon ay yun daw po ay equivalent to the yung pong ating ibinalik na pera. And yung talagang subsidy from the sin tax is around 53. So, nag-total siya ng 113 billion.
Okay.
So, paano po ma-account ng PhilHealth itong pagbabalik ng 60 billion pesos doon sa budget? Will it go to the budget itself? Anong programa po yung saan natin ilalagay yun? And is PhilHealth also willing for a breakdown, yung mga easy-to-access breakdown para po makita ng tao for transparency na balik na at na-account for itong 60 billion na to at gagamitin nga ito para doon sa what it is intended for?
Well, kung ang magiging paraan or mekanismo nito would be through the GAA of 2026, then kapag ka po na-sign na ng Pangulo into law yung GAA for 2026, then it will be released to us by the DBM. So, kung marirelease po siya sa DBM, papasok po siya sa budget ng PhilHealth. And of course, we are very willing sa larangan at sa pangalan ng transparency to account for kung saan natin gagamitin itong 60 billion. Of course, it will support the sustainability of our program, but it will also pose as a challenge for us. Kasi kailangan naming maipakita sa bawat tao at sa bawat Pilipino na yung pong pera na ibinibigay sa amin, bawat piso ay may kaakibat na benepisyo at serbisyo.
Doc Ish, baka you can refresh our memory. No? Yung 60 billion, ano ba yung original intent niya bago kinuha?
Well, it's part of our funding to support all our programs. Although ang sinasabi nila is because those are part of the idle fund.
Yes.
Kasi hindi daw namin nagagastos pa. Kaya po naiutos na ito ay ibalik. Actually, ang amount nga noon is around 89.9 billion. Pero ang lipat lang natin is around 60 billion because naglabas na ng TRO ang Supreme Court.
That's right. Pero yung idle funds, Doc Ish, was this due to yung mga investments ng PhilHealth sa portfolio or was this through savings or increased collections?
No. These are, of course, these are part of the collection, part of the investment earnings na kung saan nadadagdag siya sa pera ng PhilHealth at ang sinasabi nga dahil medyo mabunayan yung ng PhilHealth sa mga programa, ay lumalaki yung idle funds na sinusulit.
Okay.
Well, what internal reforms are we looking at, Doc Ish, to make sure that in the future, we won't be talking about this anymore? And yun po. Ano po yung tinitignan natin?
Well, for one, we already have the approved restructuring and reorganization of the corporation para po maka-adapt kami to our mandate for the universal healthcare. So that's for one. We're preparing already for that. Second is, of course, we are pursuing really the digitalization and improvement of our processes and systems to make our operations more efficient. Not only for payment of claims, but also for developing new benefits. Third is, we are already having our prioritization for the benefit plan para po taon-taon meron na tayong mga nakaplano na benepisyo, either expansion or new benefits that will come out para masigurado na yung pong pera or yung pondo ay merong pupuntahan na. So, yun po yung ating... Yes.
Go ahead, Doc.
Kaya po, actually, ngayon po, meron na tayong mga nakaplano na benefit plan for 2026 at meron tayong mga inaasahan na expanded benefits and new benefits. Hopefully, at the start of the year, meron na tayong ma-introduce.
Ano yung maasahan natin sa start of the year na binabanggit niyo, Doc, if you can share?
Well, alam niyo naman po that we are pivoting our priority to the primary care. So, at ito nga po yung ating tinatawag na YAKA program na in-introduce natin ngayong taong ito na kung saan meron tayong libreng konsultasyon, libreng gamot na dati ay 21 free medicines, ngayon po ay 75 free medicines already with a maximum of 20,000 per person per year. Tapos may libreng diagnostics din po ito. And soon, i-launch na rin po natin yung ating libreng screening test for cancer like breast cancer, colorectal cancer, liver cancer, and lung cancer. So we are really focusing now our efforts towards the primary care to make sure na malayo sa sakit ang ating mga miyembro.
That's nice to hear. Pero yung sa binanggit ni Angela, yung reforms within the PhilHealth, yung mga binanggit yung packages, yung pera na makukuha natin from yung investment portfolio, does that mean hindi na siya papasok sa savings ng PhilHealth at diretso sa mga bagong packages?
Well, actually, opo, it will actually support and make sure the sustainability of the program. Kasi kung makikita po ninyo, yun po ngayong 2025, nakapagbayad na tayo sa ating benefit payout ng 250 billion pesos as of October, which is 83% more from 2024. Kung kaya't makikita po natin na yun talagang pumapasok na pera sa atin, ay ibinabayad din lang natin sa ating mga benefits.
Okay.
Such that, and with the expansion pa and new benefits that will come out, we will make sure na lahat po ng perang papasok sa atin will be used as part of the benefit payout sa atin.
Right. Base nga po doon sa Supreme Court ruling, sinasabi nila itong paglilipat ng pondo na ito mula sa PhilHealth to the Government National Treasury ay also conflicted with the Universal Healthcare Act natin. So, I was wondering, Doc Ish, if can we guarantee or can PhilHealth guarantee na meron po kayong institutional independence moving forward to make sure po na you are going to protect yung ating pera, no, yung funds, no, yung mga reserve funds, no, against budgetary decisions ng executive?
Well, for one, the universal healthcare implementation is a whole of government, whole of society approach. So, yung PhilHealth po ay isa lamang sa nagpapatupad ng Universal Healthcare Act. Second is, ang ating pong budget for the indirect contributors ay nanggagaling sa government subsidy. At ito nga po ay nasusulat sa VAA coming from the proceeds from the sin taxes. So, for any budgetary independence, mukhang hindi po natin yan magagawa because yun nga pong nabanggit ko, we are dependent on the government subsidy for the premium contributions of our indirect contributors. But para po sa operations ng PhilHealth, ay meron naman po tayong independence on that, although the legislative and the executive has an oversight power over PhilHealth.
Alright, taking this opportunity, Doc Ish, to ask you na rin regarding yung update po natin dun sa mga backlog po ng hospital bills na binabayaran po ng PhilHealth sa mga ospital.
Well, yes. Gaya ng nabanggit ko kanina, we already have paid around 250 billion pesos as a benefit payout as of October. And on a national average po, we are paying good claims for around 23 days. So, mas mabilis po yun doon sa naka-allot na 60 days. Kung meron man po tayong mga nagtatagal sa pagbabayad, ito po ay yung mga hindi good claims. Ito yung mga denied claims o yung mga claims na ibinabalik natin kasi may kakulangan sa mga requirements or for compliance. So, para po mabayadan natin agad ang ating mga ospital, sana ay maayos at magandang claim na po ang naipapag sa nila. Yes.
Oo. Pero do we have actual figure that we can tell the people how much po yung binabayaran pa ng PhilHealth na sinasabi nilang unpaid sa hospitals?
Oh, wala akong data ngayon but I can forward it to you
Yes,
later.
please. Okay. Alright, with that,
Yes,
maraming salamat po sa inyong oras. We will continue to get in touch with you regarding these concerns. Maraming salamat po sa inyong oras. PhilHealth spokesperson, Israel Pargas.
Magandang umaga, Angela and Angelo. Thank you.